So, hi guys, I'm here at Dr. Jessica Shepherd's office at Baylor, and I'm getting ready to have my second of 3 treatments of Mona Lisa Touch. And as soon as Dr. Jessica comes in, I'm going to have her say a few quick things about what Mona Lisa Touch is, who it's for, and the benefits of it. Okay, so just a little background. I don't mind telling you guys about what's going on with my vaginal health because that's what it is, vaginal health. And so I'm having some vaginal atrophy, which can cause dryness and painful sex and urinary incontinence. I don't have that. I just have the painful sexual experiences and dryness, just probably because of the dryness. But I don't have any shame in telling you about that because men are talking about they ED and got their Viagra and Cialis and everything else. Women have this issue when they go into menopause, and I've been put into menopause because of my breast cancer. It was estrogen and progesterone fed, so they cut off my hormones as much as they can. And so now that puts me in menopause, and the symptoms that I have are hot flashes. And you know, everyone knows I have the hot flashes and I hate them with a passion, but it is pretty much my only symptom that really annoys me. Everything else, life is wonderful. But then this vaginal atrophy came along. And thankfully, they have something to help with it. It's not covered by insurance like Viagra and Cialis because men will fix their problems and move on to younger women. That's just my theory. So they'll put us to the back burner if we have any issues with going through the change of life. But yeah, I probably will work to make sure that it gets covered at some point because it is similar to a man having erectile dysfunction. It's a vaginal dysfunction. So yeah, so we're gonna fix that, girl and guys and girls. So you get 3 treatments. I'm on treatment number 2. I already noticed some improvement. So amaze balls. We're gonna be all fixed up. I'm gonna have a young vagina. Sometimes they call this a vaginal rejuvenation. Okay? All right. Talk to you soon.
It's Dr. Jessica Shepherd, and I am here with Carla. And what we're doing today is we're doing the Mona Lisa Touch for vaginal restoration, rejuvenation, whatever words you want to use, but it's for vaginal health. I think she is the perfect candidate for vaginal rejuvenation because what it does is it really addresses like the vaginal tissue. And what you'll see in women who have maybe had a lot of children, so they have laxity of kind of that tissue, or women who are postmenopausal, so they have a decrease in estrogen, so that affects how the tissue is affected by estrogen, which is like our voie de vivre of the vaginal tissue.
Yeah.
Or for women who have had cancer. And so this is kind of where Carla's kind of in that category of women who are cancer survivors. So one Carla's a cancer survivor, but for women who are out there who have survived cancer and now have had chemotherapy, maybe some radiation treatment, and that has really diminished their estrogen levels because their ovaries have been affected by the treatment from the cancer. So again, decrease in estrogen, whether it's from menopause or whether it's from a cancer treatment, is now going to affect your vaginal tissues. So the Mona Lisa is a CO2 laser, and what it does is we actually insert the probe into the vagina and deliver this energy into the tissue. And what it does is it stimulates on a very deep level that collagen, kind of like that basement layer of the vaginal tissue, which revives the tissue, it increases secretions, it's been known to help with stress urinary incontinence, it really affects the tissue, makes it much firmer and more plump, and that's really what we want women to experience, is that they can get something that can help with their pelvic health, because a lot of times it's like kind of like that back burner issue that we don't want to talk about, it's taboo, a lot of shame and guilt that comes too with any vaginal health.
I have no shame.
Pelvic. Carla does, she has no shame. But women don't want to talk about it. So I'm so glad that she is putting her story out here so that you can hear her story, you can experience what she has gone through. If you've experienced that before, that you know that vaginal rejuvenation with the Mona Lisa Touch, it's a CO2 laser, definitely you should DM her
Yep.
for questions if you want them answered. You can also DM her for questions if you want me to answer it. Or you could go to Jessica Shepherd MD on Instagram or Dallas Gynecologist on Instagram and ask me questions because I will answer them for you.
Yep.
So we are actually getting ready for her treatment today.
Number
we
2.
Won't show you.
No, we won't show you.
We won't show you all.
We have that much
but
shame.
We actually wear our laser glasses. This is Angelica, and she wears her laser glasses too.
Yeah.
Yes.
And this is the little probe I was showing you.
Right here. This is the probe right here that's inserted into the vaginal canal, delivers the energy right through. Here you'll see the window that has the laser beam.
You see that?
Yes, it is so high tech, but it's so simple. The treatments really only last anywhere from, 5 minutes, 7 minutes?
Yeah, it's not very much.
And you get
not very painful.
3 or 4 treatments 4 to 6 weeks apart. So it's very, downtime, nothing. Carla's going to go out after this and go out with her girlfriends or something.
Yeah.
But very little downtime, and I hope that a lot of women can hear her story, learn from it, and go find a gynecologist. If you're here in Dallas, you can come see me. If
Baylor,
you're
Dr. Shepherd.
Then you go find a gynecologist who can affect your vaginal health. So we're going to get ready to do Mona Lisa.
Yeah, because isn't the, what do they say? You deserve to feel better? What's the sign that was in here for Mona Lisa?
Oh, yeah, you deserve to feel better.
Yeah.
You deserve to be at your best health.
Yes, you do.
And so I feel this is a way that you can address a health topic that not many people want to talk about, but it can be addressed because, you should invest in your own health and not be ashamed.
Nope.
Yes.
Well, thanks, you guys. Dr. Jessica and Angelica, they're here for you guys.
Yes.
And they're here for me. I'm about to get this second of 3 treatments.
So now I'm going to challenge her to do a video right after so you can see that she's not in tears.
Yeah. Not in tears.
Yeah. No, she'll be just fine. So, thumbs up.
Cool. Thank you. So, guys, I'm all done. Easy peasy. And they gave me this little ice pack to put down there to make it feel, good. It feels a little tingly because they did little zaps, little laser zaps. So it feels a little tingly. But so I'm going to go home, and typically it doesn't feel much like anything. And then I put this little ice pack on, and hey, then I'll be back in 4 to 6 weeks. So I'll let you guys know how this one does in between the next visit. See ya.